You have been eating carefully. You have been taking your medication. You have been doing what your doctor asked. And still, every time you sit down at that kitchen table in the morning and wrap that cuff around your arm, the number is higher than it should be. Nobody has told you why. I am going to tell you why today. And the answer has nothing to do with salt, nothing to do with stress, and nothing to do with anything you are doing wrong. It has to do with a single mineral, one that your body cannot make on its own, one that sits at the center of over 300 biochemical reactions, including the ones that control the tension in your blood vessel walls while you sleep, one that the majority of adults over 65 are not getting nearly enough of, and one that almost nobody is checking. If your blood pressure has been difficult to control, especially in the morning, especially overnight, there is a very real chance that what I am about to share with you is the missing piece. I'm Dr. Alan Miller, and after 18 years treating cardiovascular risk in older adults, I have watched this particular deficiency get overlooked again and again. Not because physicians do not care, but because the standard blood panel that most patients receive does not measure it accurately. You can be severely deficient and walk out of a routine checkup with a completely normal result on paper. Today, I want to change that for you. By the end of this video, you will know exactly which mineral I am talking about and precisely why its absence causes blood pressure to rise during sleep. You will understand why standard blood tests miss this deficiency and what to ask your doctor instead. And I will give you a clear, practical plan for restoring your levels, starting with what you eat tonight. Stay with me through the middle of this video, because what I explain about the overnight mechanism is something most people have never heard explained before, and it will change the way you think about every meal you eat after 4 in the afternoon. Here is the truth that is almost never communicated clearly in a routine appointment. The mineral is magnesium. And before you think you already know this story, stay with me. Because the relationship between magnesium and blood pressure during sleep is far more specific, far more mechanistic, and far more correctable than most people realize. Magnesium deficiency affects an estimated 40 to 60% of adults over 65 in the developed world. The reasons are multiple and compounding. Aging itself reduces the efficiency of magnesium absorption in the gut. Many medications commonly prescribed to older adults, diuretics, proton pump inhibitors for reflux, certain blood pressure medications, actively deplete magnesium from the body. Mud and soil depletion means that even a carefully maintained diet delivers less magnesium per serving than the same foods did 30 years ago. And here is the part that makes this so insidious. The standard serum magnesium blood test that appears on most routine panels measures the magnesium circulating in your bloodstream. But only about 1% of the body's total magnesium is in the blood. The other 99% is stored inside cells and in bone. Your body will pull magnesium out of those stores to keep the blood level looking normal, right up until the deficiency becomes severe, which means you can be significantly depleted at the cellular level for months or years before a standard blood test ever flags it. Your physician looks at that panel, sees a normal magnesium number, and moves on. And the deficiency that is quietly disrupting your overnight blood pressure regulation goes completely unaddressed. Now let me explain exactly what happens inside your blood vessels when magnesium is low, and why it specifically affects you during sleep. Your blood vessels are not passive pipes. They are living muscular organs. The smooth muscle cells that line the walls of your arteries are in a continuous state of managed tension, contracting and relaxing in response to signals from your nervous system, your hormones, and critically, the minerals present inside the cell. Magnesium is the body's natural calcium antagonist. Inside smooth muscle cells, calcium triggers contraction, vessel walls tighten, the channel narrows, resistance increases, and blood pressure rises. Magnesium acts as the counterweight. It blocks calcium from entering the muscle cell, promotes relaxation, and keeps the vessel wall from contracting more than it should. This is, in fact, the same mechanism that prescription calcium channel blocker medications use to lower blood pressure. Drugs like amlodipine work precisely by blocking calcium entry into vascular smooth muscle. Magnesium does the same thing, naturally, at the cellular level, continuously, every hour of the day and night. Now here is where the overnight piece becomes critical. During sleep, the body undergoes a natural hormonal shift. Cortisol levels drop. The parasympathetic nervous system, the rest and repair branch, is supposed to take over. Blood pressure should fall. Vessels should relax. But magnesium is the mineral that enables that relaxation. When magnesium levels are low, the smooth muscle in your arterial walls cannot fully release. The vessels stay in a state of elevated tone, not dramatically tightened, but not fully relaxed either. The nocturnal dip that your cardiovascular system depends on for repair and recovery is blunted. And in many cases, blood pressure that should be falling is instead climbing through the early morning hours, driven by a cortisol surge that has nothing adequate to buffer it. This is called the morning blood pressure surge, and low magnesium is one of the most consistent and most overlooked contributors to it. Let me tell you about Clarence, 72 years old, a retired electrician from the Pacific Northwest. He had been managing hypertension for 9 years, 2 medications, consistent diet, regular walks with his wife every morning. By every measure, he was a compliant, engaged patient. His daytime readings were acceptable. His morning readings were not. He came to me specifically because of that gap. Evening readings averaging around 126/74. Morning readings consistently above 148. His previous physician had attributed it to white coat anxiety and morning activity. But Clarence took his readings at home, sitting quietly, before he stood up. The gap was real, and it was consistent. I ordered a red blood cell magnesium test, not the standard serum test, but a test that measures magnesium inside the red blood cells, which gives a far more accurate picture of actual tissue-level magnesium status. His result came back at the low end of deficient. His serum magnesium, by contrast, had been normal on his last 3 panels. We introduced a magnesium glycinate supplement, a highly bioavailable form I will explain shortly, at a dose of 360 milligrams, taken with his evening meal. Within 6 weeks, his morning readings had dropped an average of 16 points. His evening cardiologist noted the change at his next quarterly visit and reduced his diuretic dose. Clarence told me, almost as a footnote, that he was also sleeping more deeply than he had in years, which is not a coincidence. Magnesium plays a central role in regulating GABA, the primary inhibitory neurotransmitter in the brain, and its restoration frequently improves sleep quality alongside blood pressure. I want to spend a moment on something that I do not think gets enough attention in the standard blood pressure conversation. Many of the medications most commonly prescribed for blood pressure and related conditions in older adults are themselves magnesium depleting. Thiazide diuretics, hydrochlorothiazide, chlorthalidone, are among the most frequently prescribed blood pressure medications in the world. They work by increasing urinary output, which reduces blood volume and lowers pressure. But they also increase urinary excretion of magnesium. The medication lowers your blood pressure by one mechanism, while simultaneously depleting the mineral your body needs to regulate blood pressure by another. Loop diuretics, furosemide, bumetanide, used in heart failure and resistant hypertension, deplete magnesium even more aggressively. Proton pump inhibitors, omeprazole, pantoprazole, esomeprazole, widely used for reflux and gastric protection, reduce stomach acid in a way that directly impairs magnesium absorption in the small intestine. The FDA issued a safety communication on this relationship over a decade ago. it remains underappreciated in clinical practice. If you are taking any of these medications, your magnesium depletion risk is not theoretical. It is active and ongoing. And if your blood pressure has remained difficult to control despite medication adjustments, this is a conversation worth having with your physician explicitly. Miriam was 68 years old, a retired librarian. She had been on a proton pump inhibitor for acid reflux for 11 years and had been taking hydrochlorothiazide for blood pressure for 7. She came to me because her blood pressure had been escalating for the past 18 months, despite 2 medication increases in that period. She also mentioned, almost apologetically, that she had been experiencing leg cramps at night, the kind that wake you from sleep, and occasional heart palpitations that her cardiologist had investigated and attributed to anxiety. Nighttime leg cramps, palpitations, resistant hypertension, 2 magnesium-depleting medications taken simultaneously for years. I want you to hear how clearly this picture speaks once you know what to look for. Her red blood cell magnesium came back significantly deficient. We worked with her primary care physician to introduce magnesium supplementation carefully, starting low, building gradually, and to discuss whether her reflux medication could be stepped down or replaced with a less absorption-impairing alternative. Over 4 months, her leg cramps resolved entirely. Her palpitations decreased markedly, and her blood pressure, for the first time in over a year, responded to her existing medication without requiring an increase. Before we continue, and this is important, please do not adjust or stop any prescription medication based on what I am sharing today. Magnesium supplementation is generally very safe, but it can interact with certain medications and conditions, including kidney disease, where magnesium clearance is impaired. Always discuss any supplementation with your physician before beginning, particularly if you are managing a chronic condition or taking multiple medications. What I am sharing today is educational, meant to give you the language and the knowledge to have a better, more specific conversation with your doctor. Now let me give you something practical. Because magnesium's role in overnight vascular relaxation means that what you eat in the evening has a more direct impact on your nighttime blood pressure than what you eat at breakfast. When you eat magnesium-rich foods in the evening, those minerals are absorbed and circulating through the night, available to your smooth muscle cells during the exact hours when your body needs them most for relaxation and pressure regulation. The highest magnesium foods available to most people are as follows. Pumpkin seeds, also called pepitas, are the single most concentrated dietary source of magnesium available. A 1-ounce serving contains approximately 150 milligrams. A small handful as an evening snack is one of the most effective and simplest dietary changes available. Dark leafy greens, specifically spinach, Swiss chard, and beet greens, are exceptional sources. A half cup of cooked spinach delivers approximately 80 milligrams. These are practical additions to any evening meal. Black beans and edamame. A half-cup serving of either delivers 60 to 65 milligrams of magnesium, along with potassium, another mineral critically involved in blood pressure regulation, making them a genuinely cardiovascular supportive food combination. Dark chocolate, specifically 70% cacao or higher, contains approximately 60 milligrams per 1-ounce serving. I mention this not as license for excess, but because it is a real food that many older adults enjoy and that genuinely supports vascular health when consumed in modest amounts in the evening. Avocado. Half an avocado provides approximately 30 milligrams of magnesium, alongside monounsaturated fats that support endothelial function, and the potassium that works alongside magnesium in vascular smooth muscle regulation. The goal is not to eat all of these in one evening. It is to build a habit of incorporating 2 or 3 of them into your dinner or evening meal on most nights, creating a consistent nightly foundation for overnight vascular relaxation. For many older adults, dietary sources alone are not sufficient to restore depleted magnesium levels, particularly when absorption is impaired by age or medication. Supplementation is often necessary. But not all forms of magnesium are equal. This is where most people get confused. Magnesium oxide is the most common form found in inexpensive supplements and many multivitamins. It has the highest elemental magnesium content by weight, but it is poorly absorbed, less than 10% bioavailability in most studies. Much of it passes through the gut without being used. It is also the form most likely to cause loose stools or digestive discomfort. Magnesium glycinate, magnesium bound to the amino acid glycine, is the form I recommend most consistently for blood pressure support and sleep. It has high bioavailability, is gentle on the digestive system, and the glycine component has its own mild calming properties that can support sleep quality. A typical therapeutic dose is 200 to 400 milligrams, taken in the evening with food. Magnesium malate is another well-absorbed form, particularly useful for individuals who also experience muscle fatigue or fibromyalgia-like symptoms alongside their blood pressure concerns. Magnesium taurate, bound to the amino acid taurine, has emerging research specifically in the cardiovascular space and may be worth discussing with your physician if your primary concern is blood pressure and cardiac function. Start low, build slowly, and take it in the evening, not the morning, to align with the overnight mechanism we discussed. Here is what I want you to sit with for a moment. You have potentially been fighting your blood pressure for years, taking medication faithfully, restricting sodium, exercising when your joints allow, doing everything that has been asked of you. And the number has still been difficult to control, especially in the morning. And all along, there has been a mineral, abundant in food, inexpensive in supplement form, testable with the right blood panel, that your body has been quietly running low on, that sits at the center of the exact biological mechanism responsible for your overnight vascular tension. That is not a failure on your part. That is a gap in what you were told. And now you know. Step 1. Ask your doctor specifically for a red blood cell magnesium test, not a standard serum magnesium. Explain that you are concerned about tissue-level magnesium status, and that you understand serum levels can appear normal even when intracellular stores are depleted. This single conversation could open a door that has been closed for years. Step 2. Rebuild your evening meal around magnesium-rich foods. Prioritize pumpkin seeds, cooked dark leafy greens, black beans, and avocado as regular fixtures of your dinner or evening snack. Aim to incorporate at least 2 of these sources on most evenings. Consistency matters far more than perfection. Step 3. If you are taking a diuretic, a proton pump inhibitor, or both, have an explicit conversation with your prescribing physician about your magnesium status and whether supplementation is appropriate alongside your current medications. Bring this video's topic to that appointment if it helps frame the conversation. Step 4. If your physician supports supplementation, begin with magnesium glycinate at 200 milligrams in the evening with food. After 2 weeks with no digestive discomfort, you can increase to 300 or 400 milligrams if needed. Do not begin supplementation without physician approval if you have kidney disease or significant renal impairment. Step 5. Track your blood pressure morning and evening for 4 to 6 weeks after making these changes. A morning reading and an evening reading logged consistently will tell you whether the intervention is working. Bring that log to your next appointment. A sustained drop in your morning reading, the hardest number to move, is often the clearest evidence that overnight vascular relaxation has improved. Your body has always known how to regulate blood pressure. It was built for it. The mechanisms are elegant, the chemistry is precise, and the raw materials your body needs have been available in the earth and in food for as long as humans have existed. Sometimes the problem is not that the system is broken. It is that the system is running low on something essential, something quiet, something that nobody thought to check. Now you know what to check. And tonight, you can begin giving your body what it needs. I want to hear from you in the comments. Has your doctor ever tested your magnesium specifically? And if you have already been taking a magnesium supplement, which form are you taking? And have you noticed any difference in your sleep or your blood pressure? Tell me below. Your experience in this community is exactly the kind of real-world signal that helps other people make better decisions. If someone you love is managing blood pressure that has been stubborn or difficult to control, please share this with them, not as a replacement for their medical care, as information that might finally explain something that has been unexplained. And if you want to go deeper into what happens to your cardiovascular system during the night, the next video covers the specific evening habits that trigger a blood pressure spike between 2 and 4 in the morning, including one that almost everyone over 65 does without realizing it. I will see you there.